All right, and I think that means we're live. So welcome back to WMPEDS-Live. This is episode number 2 now, so welcome back. And today I'm joined by Dr. Alison Cullinane. Welcome. So Dr. Cullinane is going to be here today, and we're going to touch on definitely a different topic than last time, a different perspective than last time. So why don't you tell us a little bit about what we're going to talk about today?
Sure. So first of all, I am Alison Cullinane. So I joined the practice. I'm one of the new pediatricians. I joined the practice actually close to almost a year now. It was last summer. I have 2 young boys. So I have a 7-year-old who's in first grade and a 4.5-year-old, so almost 5-year-old in preschool. And like many of you, this has obviously been an adjustment for us, right? Adjusting to being home in quarantine, adjusting to managing working from home, not having school, all of that's been quite an adjustment. And so I've been hearing a lot as a friend in terms of my friends talking about their kids and how they're adjusting to everything going on with quarantine. I've been hearing a lot from parents of my patients about all the adjustments that everyone's been going through. And honestly, we've been going through a lot of those adjustments ourselves here at home. So Joe and I thought it would be a good idea that would be something else we could talk about today. It's a lot of those different things that we're all dealing with and how we might be able to navigate them together.
Yeah. What do you think have been some of the biggest difficulties that you've faced? I guess, first of all, as a parent, and then we can kind of go into how maybe we can address these and what other parents can do to address those.
Yeah. I mean, obviously, I think some of those things have changed over the last 2.5 months, right? The things that a lot of us were dealing with at the beginning may be a little bit different than they were in the middle and than they were in over the last few weeks. But the biggest thing, I think, for me and my husband and our family was how to balance being a teacher, a stay-at-home mom, and an employee all at the same time.
Yeah.
And that's a lot of hats, right? And having to, it's not just me, it's my husband, and how we're all balancing that. And that was a lot of adjustment for my kids, I think, as well. And there is definitely some ups and downs, and some days where I felt like, oh, I've got this, we figured it out. And then there were plenty of days when I was like, this is really hard.
Mm-hmm.
And we're still figuring it out, to be honest with you.
Yeah. So what are some of the things that we can do to maybe, help us along, and especially while we're still going through some of the quarantine time here, what are things that people can focus on to help with all these changes?
I mean, I think that some of the biggest things are trying to figure out like what our biggest hurdles are, right? So one of the things that, for example, that we dealt with a lot of was the uncertainty, right? And kids ask questions. How do you talk about this with your children? How do you talk about it while explaining it to them without scaring them? So one of the things I think that we kind of addressed is trying to, and I know that our behavioral health specialists were awesome at the beginning of all this, to kind of help give us some pointers, but really trying to remember not to talk about uncertainty and the concerns that we have as adults in front of our kids. Kids have a really hard time trying to verbalize their concerns too. Are internalizing what we're saying, even if they're not repeating it back to us. So I think one of the really important things is trying to remember to hold those conversations. Go to bed, or they're not in the not in the same room with you. That's a huge part of it. And then trying to explain to them that they're safe. And that what we're doing is to protect others. That can sometimes be a good way to remind them to do things for the rest of our community, but also give them some sort of comfort that they're going to be okay and provide some reassurance for them too.
Yeah. So what do you think is the best way to, share some information with the kids without kind of sharing too much that it might, really bother them and really get them anxious and stressed?
Yeah. I think that question depends a lot on how old the kid is, and how curious they are about things, and how much kind of nerves and anxiety they might kind of have at baseline. So an older kid, I would be pretty honest with them about. A teenager, I would be pretty honest about with them that this is, a dangerous virus. It's worse than the flu. We're staying home. I'm not worried about you. We're going to be okay. We're going to be safe, but we're doing it to protect others. Younger kids, I would try and make it something relatable. So it's like the cold, it's like the flu, or it's like a cold that you got, over Christmas, but it's a lot worse. And so we're staying home to keep those germs away from them, trying to kind of make it something a little bit more relatable for them.
Yeah. And so, with all these changes, there's bound to be, major behavior changes that probably lead to some nighttime battles and sleep disruptions. And, I'm sure you've probably experienced that. What recommendations do you have for other parents that are going through some changes there?
Yeah, that I would say is probably like one of the biggest things I've heard. So some of the biggest things we've heard are sleep problems, behavior issues. So whether it's fighting with their siblings or temper tantrums, or if they're maybe a little bit older, some more oppositional stuff. Some of the other things that we're hearing for some of the younger kids is like regression. So they were fully potty trained and now we're going backwards, or all of a sudden they're asking for their binky, their pacifier, and they haven't had one for 3 months, those types of things. Sleep is a big one I've heard from a lot of people. And I will tell you, it's been something that we have been dealing with a lot here in our house. We're getting close to bedtime, so hopefully you don't hear any of that from the room, but there's a possibility that you might, and I apologize in advance if we do. So the thing with sleep, so first of all, 2 caveats I'm going to put out there. Number one, a lot of these things that we're talking about, they have a lot of complexity, right? Everything depends on COVID, depends on the age, their baseline level of anxiety or activity or whatever, as well as the circumstances. So things are going to be very different for a family of a single mom versus 2 people who are both working from home versus, someone who's working in the hospital and dealing with being exposed to COVID, or someone who's had a sick family member. So we recognize that like those complexities are very different. And so these are just kind of some general recommendations and guidelines and some general things that we've been seeing. And feel like you've tried some of these things over the last, few months or weeks and they haven't worked, or you try them over the next few weeks and you're not getting anywhere, obviously reach out to your provider. Any of us would be happy to talk about in more detail and kind of give you a more kind of customized approach. That's caveat 1. Caveat 2 is I'm a pediatrician who cares about all this and who has studied a lot about this and trained, but I'm also living it right now. And some things work great and some things don't always work so well. So it's trial and error. There's not an easy fix for all of this, and it's not a one size fits all. So I say that not to kind of dampen your confidence in me or in any of us as pediatricians, but to kind of, we're going through this together and we're going to figure it out together. So those are caveats. So the things with sleep. So some of it will depend on age, right? But a lot of the things with sleep, I think, are going to be the same, whether you're dealing with a teenager or a toddler. And the biggest thing, the first kind of general things that I would talk about would be what I call sleep hygiene. So we all know that we're based on a circadian rhythm, and getting to bed at a similarly decent time, waking up at a similarly decent time. All of that is really important for your body to understand, hey, it's time to go to bed, it's time to wake up, and feeling well rested the next day. We all know that it's slipping a little bit during quarantine.
Yeah.
My entire family is sleeping the latest they ever have before in their entire life. But we're also seeing more behavior problems with that. So it is really important to try and get back to a more normal sleep time and pattern for your kids and for your family. And again, that would be true for a toddler versus an adolescent. Some of the other things I think are really big and that are kind of really a big challenge during quarantine is a lot of sleep doctors and sleep specialists will say you want your body to realize when you walk in the room that you're sleeping in, that this is your area of calm. This is your area of sleep.
Mm-hmm.
That can be hard for a 14-year-old who's having the only place they can do their work quietly is in
Yep.
or a 3-year-old where they keep most of their toys in the room and they're there all day instead of going to preschool.
Yeah.
Yeah. So that
I feel like a lot of college kids go through that their first couple of years in college because they do all their homework in bed and kind of the same thing, you know?
Yeah, it's a great point. Absolutely. But to that point, if they could at least little things can make a difference. Trying to do your homework at a desk in your room or, set up a little desk if you don't have a desk, trying to leave at least your bed or your toddler's bed or whatever as kind of that safe sleep zone can help trigger to your brain that, hey, this is where I'm supposed to sleep. The other thing that I recommend is what teenagers hate me saying the most. So we all know blue light, right? But it's true. There's science behind it that the blue light triggers a gland in your brain to read it as sunlight. So being on an iPad, being on a phone, and it's not just the teenagers; it's the kids. Like being in front of the TV or a tablet or something too close to bed is going to totally throw off your sleep cycle. So trying to shut those down like an hour or two before bed, too, if you can really be helpful for sure. I could go on and on about sleep. I'm happy to if there's more things, but those are kind of some of like the real brief highlights I would definitely mention.
Yeah. And I think some of this is, it's difficult too with, there being less structure and especially going into summer and it's probably for a lot of kids felt like summer vacation for the last 3 months at this point. When we get back to the school year, whatever the school year looks like, that's going to be tough, So the earlier that they can get into that rhythm now, I think the easier it'll be for them to, kind of get used to it and adapt back to life as normal, I guess you could say.
And whatever that normal will be for us.
Right.
That's true. But actually, Joe, to that point, I think there's something to be said too about how much structure versus unstructured you have during your day can affect your sleeping. I mean, it can affect behavior and a lot of the other things that we're seeing too. But if a 2-year-old kind of gets bored during the day, if you're not mentally kind of, I don't want to say exhausted, but let's say tired out by the end of the day too, it's going to be a little bit harder to unwind. So physically getting activity, mentally getting activity. On the flip side, I think like anything in life, there's balance, right? You need structure, but you also need time for your teenagers and your kids to have some unstructured time too. So trying to find that balance. And that can be really hard for parents that are working from home and kind of just need, a preschooler who doesn't have Zoom calls all day, for example. It's harder to find that structure for them. Sometimes it might just be like the night before trying to come up with just a couple of things to put out for them that maybe provide a little bit of independent structure, like a little area where they can do some arts and crafts or something like that. For a 3-year-old, but something that can give them some sort of structured play while the parents are able to do some work can help a little bit to kind of give you that mental stimulation, but then also give you some time for play during the day.
Right. So I know you talked about the kids, putting away their phones before bed and all that. And I assume what they're probably doing on the phones is a whole bunch of social media and talking to their friends. I think this is a perfect recipe for potentially, misusing social media, but also using it appropriately. Do you have any advice for kids to kind of use it the right way during these times? Because certainly there is a use for it to stay connected to friends and family and all that.
Yeah. I've actually had a lot of parents ask me about that, like what's the right amount of time to be on it? And I think that's it's a hard one because technically the American Academy of Pediatrics still recommends that screen time shouldn't be more than 2 hours, during the day during this. With that said, if that's including school time, that's really difficult, right? But I do think one of the things that we're missing through this is kids being able to build their independent friendships.
Mm-hmm.
So, for example, my 7-year-old, we lived in a different state in kindergarten, had a few friends, not a lot of tight friends. He's in first grade and made some great friends. And I was so proud that he was starting to build these independent friendships. So now to have that cut so short, you want them to be able to maintain those friendships and find a way to do it, but do it safely. And so social media can be a way to do it, or online resources. There's one in particular that I really like for younger kids because it allows parents to really kind of be actively involved. Messenger Kids, that is through Facebook. You approve and deny any kind of friends that your children are interacting with. And this is my own personal endorsement. It's not anything that has been endorsed by the American Academy of Pediatrics, but I've liked it just kind of in my experience with my son. But you're able to then see how you know that child.
Oh, interesting. Yeah.
So the parent is helping to request through their child, that type of thing. So you're requesting or you're approving only people who I would say who you would feel comfortable with them babysitting your kid, for example. Right. That would kind of be my level of comfort of who I would let kind of talk to them through Messenger. But it's a great way. They can type, they can draw pictures, they can play little kind of innocent games together. And one of the things I've talked to some families about, and my son's friends' families about, was it's really easy for us to want to sit right next to them and guide them through those calls. Like, say this, like ask them how their day was and those types of things. And yes, there's benefit to them to kind of teach how to have a social conversation. But at the same time, that's not mimicking what they're missing. What they're missing is like those conversations that you have in passing in the hallway, right? And that, I think, is an important part of development. And it's been very hard for me to be hands off and let him kind of have those conversations where I can't hear him. But I personally think that's important.
Yeah, definitely. It seems like there's a lot of things in place at this point to kind of get people through where we're at now. But what are you most worried about as we're moving kind of through the phases, especially in the state of Massachusetts, where I think we're about halfway through phase 1, looking like we're making pretty good progress into phase 2. And once things start to open up a little bit, what are you worried about when things change?
Yeah, I mean, I think the obvious first one, right, is what everyone's worried about. We all want to make sure that we all stay safe and that, there aren't more people getting sick than we were expecting and we're able to kind of keep everyone safe. But above that, I would say what I'm most worried about in terms of our kids and their social, emotional development is, I was actually just talking to a mom about this morning in clinic, but separation anxiety. I mean, when was the last time that we have been 2.5 months straight, all day, every day with our kids? Most families are going to say that it's been a very long time, if ever, that's happened. Mm-hmm. Never any other time that there's been a grandparent coming by and, watching them while, you go take a nap when they're babies or going to school. And so I do worry about separation anxiety for all ages. I worry about that with the toddlers and, even the school age kids, depending on some kids are probably going to be running out the door and ready to go. Yeah. But there are others where this is going to be a change for them.
Yeah. Yeah. So, I mean, knowing that eventually we're going to get there,
right.
What do we do now?
Yeah. So my suggestion, obviously we've never been there, so we'll have to see if this works. But, one of the things I've been trying to do at home and I've been kind of talking to some of my families about is trying to find ways in it's somewhat artificial, I get it, but trying to find ways where you can kind of create a little bit of separation from your kids, even if it's a 18-month-old that's going to have to go to daycare in a few months. Say it's an 18-month-old, for example, who can play by herself for a little bit. You're probably not leaving her in a room too often by herself for too long, but I would, as long as it's a safe room, everything's child-proofed, mm-hmm. I would intentionally step away from that room for a little bit, or a 2-year-old or a 3-year-old, whatever. Step away from that room for a little bit. Let them play by themselves. give yourself a break for a few minutes. And then I think what the important thing is to come back in before they notice you're gone and start getting upset or worried, and point it out casually, but you did such a great job playing by yourself. You didn't even need me here. You did a great job. I'm really impressed. And then the next time, maybe make it a little bit longer and a little bit longer and a little bit longer, but always trying to get back before they get upset. So you don't want to trigger that anxiety. And then, like everything, positive reinforcement and telling them what a great job they've done.
Yeah. And what advice do you have for people if they try this and it doesn't go so hot, and next thing you know, the kid is having that separation anxiety and isn't doing too well with it?
You mean like when we start opening back up again, or kind of?
A little bit of both. So, as things open up, if kids are already experiencing this, because I think at this point, some people are, already going back to work. What if people are going through this right now and they didn't have that opportunity to kind of be proactive with it?
Sure. So trying to, and I realize not all this is feasible, but trying to sometimes do things stepwise, or do things slowly as much as possible can be helpful, right? At the same time, if you send your kid to daycare and they're younger, 1 day a week, that might actually make things harder, because then they have 6 days to kind of feel like, okay, that was a one-time thing. And then you have to go through it again, the next week and the next week. So even if it was trying to work out a way where it could be a few hours a day for the first week, that can be helpful. And then a big thing I would say for, depending on the age of the kid, and actually for a lot of issues that we're seeing, things that, we haven't even touched upon yet, like behavior problems, or is talking to them, to be honest with you, even with like a 6-year-old, a 7-year-old, tell me how you were feeling today. Mm-hmm. Modeling kind of those discussions. A lot of times it can be hard for the kids to kind of voice that uncertainty, right? Like, I didn't know if you were coming back, or I didn't know how long this was going to be, and I was nervous, I was scared. So when they're calm at the end of the day, how are you feeling today? Like, what were your feelings? And sometimes they'll be like, what do you mean? What's a feeling? Were you happy? Were you sad? Were you frustrated? And giving them time to answer, letting there be a little bit of quiet space, giving them some time to answer. But then also modeling it. Like, I was really happy today when I did this. I was really sad today when I did this. Obviously temper those things that were really sad, make it appropriate for a 4-year-old or a 5-year-old, whatever it may be. But kind of showing them how to talk through those feelings. But then in the end, kind of just reminding them and giving them some comfort about whatever it is they may be worried about. And I know it was probably a little hard for you today to go back to school because it was new, but school is a really fun place. You're going to go again tomorrow, but it's going to be short, and mommy or daddy or whoever is always going to pick you up at the end of the day.
Yeah.
And kind of preparing them again a little bit for the next day. And also parents, I'd say giving us a little, cutting ourselves some slack, knowing it's going to be hard and it's not your fault. And in the end, I think the kids will be okay.
Yeah. Well, that's actually a perfect segue. Just to remind people, we do, if anyone has questions, type it in down below. We do have a couple that I want to get to. And what we were talking about before is literally a perfect segue into the first one. It's a 2-part question, so I'll ask the first part, and then we can go to the second part.
Sure.
A mother sent in a question. She is dealing with some of that irritability and anger in her 7-year-old. I assume she means it's it's since the whole quarantine thing started.
Right.
And you kind of answered the question already, but is there any other advice that you would have for her to maybe talk through things, or especially given that age?
Yeah, I mean, I think a lot of that, right? I think one of the biggest things is remembering to have those conversations when the kids are calm. Because once they get angry, like, it's hard to reel it back in. I mean, I think about when I get really angry, it's hard for me to kind of sometimes take a step back and think rationally. But that can be one thing. It's really talking through and trying to figure out where that anger is coming from. Mm-hmm. Is it anxiety? Are they nervous about something? Are they just feeling really cut off from their friends? And sometimes when you have those conversations, and it may take multiple nights of having those conversations, but sometimes they may say, I really miss my friends. Well, then trying to find a way to do it. Like, I get it. They're not going to be able to come over and have a sleepover. That's not, unfortunately, where things are. But whether it's finding a way to connect with them through Messenger Kids, or, doing some good social distancing, bike riding from far away if you really do trust them and you can be with them to kind of keep that 6-foot distancing, and trying to find out where the anger is coming from or where the irritability is coming from. Some of the other things I think sometimes that we're seeing with kids that are getting really angry or siblings that are fighting a lot sometimes is a lot of kids aren't used to, and it depends on everyone's situation, right? But so if you're someone who works, if you're working out of the home most of the time and your kids are at school, when you come home, most parents are really trying to kind of focus on the kids. How was your day? How was homework? What were you doing? You're not used to spending 4, 5, 6 hours a day saying, I can't talk to you right now. I have a meeting, or I'll be right back. I have to go do this, or I have to go do this. Mm-hmm. That's a big change for the kids. They can't really completely conceptualize that in the evening you're still focusing on them, right? They're just seeing that 5-hour stretch where you may only be able to interact with them for certain periods of the day. So if you feel like that is what's kind of leading into some of the irritability, one thing I think can be really nice and can kind of be recentering for the whole family and for the parents too is dates with your kids. So taking turns, mom, dad, if you can do it every day and it's 10 minutes a day, fantastic. If it's just on the weekends and you do it for a couple hours, great. But trying to take turns where mom gets an hour or two on the weekend of just focus time with that kid. And then you swap. No phones, no anything. Let the kid decide what they want to do. I think that can be a really nice experience and can kind of help the kid refocus with that parent and remind them that you are focused on what they're worried about and what's going on. Plus, no matter how great siblings are getting along, how often are they together every waking hour of the day? They probably need a little bit of space. So kind of giving them that independence with the parents too, if that's kind of what's leading to some of the issues, I think can be helpful.
Yeah. And the second part of that question, I can actually kind of tie in with another question as well. Sure. It's really just about kind of potty training and potty training regressions. Are you seeing a lot of that with other people? And
Yeah. I had a couple friends reach out to me about it, and we've seen a few patients about it too. So a few things I would say is, obviously we can talk about the behavior side about it. There's obviously still the doctor side of me about it. So if you have any concerns that it's something more than just a regression, obviously reach out to your provider. Which some of the red flags of that would be if they used to be dry at night, but they're wetting in the middle of the night too. That would make me more concerned that there's something, more medical going on, or if there's any other symptoms. But if it's kind of inconsistent or it's happening, some of the time, not all the time, and it seems to really be more just like a behavioral regression. What I think in this situation is give it a break. If sometimes focusing too much, sometimes that's a kid's way to have control in a world right now where they have no control over anything. And if they say, I just don't want to pee over there, I don't want to pee on the potty, I'm going to pee on my diaper, I'm going to pee on the floor, or whatever it is, that's their only sense of control. So making it a fight, making it something that you're kind of trying to constantly negotiate can kind of redraw the attention on it, where really sometimes okay, fine, that's fine. We'll let them regress for a little bit. They're not going to want to be in a diaper forever. This will not be forever. I can't give you an actual timeline of when it might go away. But what I would say is give it a week or two and then kind of readdress it and kind of start back how you did again, of just tons of positive reinforcement. And when it becomes an issue and there's a fight, I would just back off.
Yeah. Would you apply that same thinking, just because we had another question about this, towards eating as well? So somebody that used to be a picky eater, used to not be a picky eater, now is, just not wanting to eat any of the foods that they used to enjoy and have had major changes there. Would you just kind of, let it be for now and see how things go, or what would you do?
I think I would, because again, it can be, it could be a control issue, and all providers may have different recommendations, but I think that's what I would say in the big scheme of all this. this is hard, right? I'll be honest. Yesterday was a hard day for us in our household. Things were hard, and you have to pick and choose your battles. And if that's not the ones that you really, think that is, if that's not really something that's a huge issue, I think it'd be okay to let go. The other thing to keep in mind is we have an amazing team of behavioral health specialists that can help with some of these things. So if you feel like it's something that's getting to be a little bit more than maybe just a little bit of a control issue, or even if it's just a control issue, but it's really getting to be a big issue for you at home, our behavioral health specialists are awesome. They're doing this virtually, and they can meet with you online virtually if you haven't already done it with some of our providers. And sometimes it can just be meeting once or twice, and they give you great tools of how to manage, whether it's some of the regressions or the picky eating, and can kind of help you through it and give you the tools that you need to kind of get you through the end of it.
Yeah, that's perfect. That's perfect. We do have a couple questions just about kids refusing to do their homework. They have their online classes, and I can't say I probably wouldn't have been the same way, but what advice do you have for the parents that are battling with that right now?
I have a couple things that I would say. One is, I think it depends on the age, right? If you have a 9th grader, a 10th grader, an older kid who, as long as they're not really struggling with quarantine and they're just kind of just refusing. Look, there's certain times where, we talk all about positive reinforcement, but there's also certain times where there's consequences for your actions, right? If you're not going to do your homework, or if you're not going to do this, and I would treat it just like you would if they weren't doing their homework at school and you were getting calls from the teachers, okay, well then you've lost this privilege. We've earned, your tablet time by doing getting your responsibilities done. For younger kids, the kindergartners, the first graders, I'm struggling with this even with my rule follower first grader who has never had any issues in school. I kind of go a few different ways, to be really honest. I might not say the most popular thing, but I think it depends how often it is and how big of a deal it is to the teacher. Some of the things I would say, is it really worth the fight in terms of you're not meant to be the teacher? And yes, you're still supposed to be the disciplinarian. But if with everything that's going on, if it's just going to cause a lot of fighting during the day and, maybe there are certain things that's not worth it. And you kind of turn to the teacher and say, hey, can you have a one-on-one with him or her and kind of discuss why it's important? Because a lot of those things would be something that the teacher would be having those conversations with in school before they'd come to you. Mm-hmm. So kind of trying to use those avenues the same way that you would during the school day or during the school year. And then trying to do a lot of positive reinforcement. I think with younger kids, if it's even like, sticker charts, those types of things, and kind of trying to figure out why. Is it because they're not understanding the work and it's hard for them to learn through it, virtually? Talking to the teacher about it. If it's just their control, trying to, again, the behavioral health specialists are great when it comes to like trying to manage some of the control issues. And picking and choosing. Like, yes, they need to get some of their schoolwork done, but if it's not going to change their grade, I think maybe talking to the teacher yourself about how important it is.
Yeah, I don't know if this is happening, but it seems like now more than ever there should be parent-teacher conferences even more frequently than usual. Are they doing it in different districts, or how are they managing those virtually? Because it seems like a perfect thing to do.
I think it really probably depends on where everyone is. And to be honest, my son's school did a great job of it at first. We've had some check-ins, but nothing to that extent. And I agree with you. I think that'd be awesome. And I think we need to remember that this is really weird for us as parents, but you can always instigate those calls, those emails, like, hey, like, can we just like touch base? Like, my son's really struggling. I don't want to ruin my relationship with him by trying to be a teacher and fighting him, but I want him to understand that it's important to do his work and be held accountable and those types of things. Can we have a call? And sometimes teachers can just kind of alter the way they're managing the projects for the kids, and that can help a lot.
Yeah, that's perfect. That's perfect. We do have a couple other questions. I think we touched on like parts of them last time, but I'll go through them quickly. Is getting your kids together in the pool this summer okay if it is a small group? That is probably one of the most common questions I've seen in the past 2 weeks.
Yeah, because it's been hot out and everyone.
Oh yeah, it's hot.
Yeah. So the official CDC's kind of recommendation or comment is that coronavirus is not spread in the water, right? You're not going to spread it by drinking pool water of someone who was in the pool that had coronavirus. But we know that it's shared by respiratory droplets. So if you can be in the pool and be 6 feet away from someone else who you haven't been quarantined with, and you or your kid, then in theory that would be safe. The thing that's hard is how many 10-year-olds can play in the pool together and really truly be 6 feet away from each other. And so that would be the big kind of thing. And obviously, if you do feel like you can do it, and you can maintain still that physical distancing in the pool without breathing on top of each other, don't wear your masks. This would be the one time we would tell you like not to wear your mask. That gets wet, and it's probably not going to end well. You're not going to be able to breathe very well through those masks. So
yeah. The other thing is don't share pool equipment. Noodles and floaties and going up and down the stairs, touching the railings.
Goggles.
Goggles. Yeah, exactly. So no diving for the little, things or any of that. That's it's tough because I mean you can do it, but how much fun are you gonna have?
I know.
If it's hot, then it's nice.
You could have races, right, and swim laps.
Yeah. Right.
Yeah.
True. The other question that we had, which I think we touched on in an email that we sent out to the practice that Dr. Strauss had written. The question is really about a parent expecting to bring home a newborn soon and whether or not she can have, the rest of the family meet the baby and how to handle that whole ordeal.
Right. I will try to do Dr. Strauss's email justice because he had a lot of really great information out there. But I think the way he kind of framed everything was, right, try and look at like, what's the risk? We know what that is, right? Like giving COVID to whoever is visiting or getting COVID, whoever is with you. What's the perceived benefit? So some family members will say, I am willing to take that risk. I completely understand, but I have to see my grandchild. If it is that important, then maybe that's something that, the family decides together. But if you have someone who's high risk, which most grandparents are, and has additional medical conditions that puts them at even higher risk, that kind of heightens your risk level. And then what can I do to kind of mitigate that risks? So if you guys decide as a family that, yes, we're going to do this, trying to do it safely, trying to, have the grandparents, maybe putting on a sweater or something like that so that they're covered, wash their hands, wear a mask before they see the baby to help protect the baby, and making sure that there is all honest conversation amongst each other about, have you been feeling sick? Have you been around anyone? How protected have you been? One of the most important things I think in these conversations is, as much as we want to help you answer those questions, it's hard for us, right? These are very personal questions and discussions for families to have. So trying to use that framework, but making sure that everyone's talking and being really honest with each other and kind of helping to answer the questions together.
Right. Yeah. Because I think the most difficult thing with this question is the second you start to involve more people and I guess your circle widens, if one single person does something that they shouldn't, they're putting everyone inside of that circle at risk. So you really need to pick and choose and have full trust, obviously, that those people in your circle are not maybe going to the grocery store more than they have to, and
Right.
doing activities that put them at more risk, because it's going to put everyone else at more risk.
And to that point, you own everyone else's risks and risky behavior, right? Once you do open that circle.
Right.
And the other thing to keep in mind is, by being at the hospital, by having delivered, even if you're being careful, you've been exposed. So there's always that possibility that you or baby are exposing the grandparents who are at highest risk.
Right. Right. And I think this might be a good opportunity to just briefly touch on the whole quarantining thing again, because, it's certainly an option. And if people choose to kind of agree to join someone else's circle, the risk is pretty low if everyone is following kind of the same guidelines and they kind of agree to be part of a team, but quarantine, I guess.
Yeah.
But I guess, if someone is expecting and, they're not quite there yet, they might have time to implement something like that, now that they know, well in advance that they can at least plan for it. Something to consider. But
yeah, no, I think that's a good point. It's that whole same discussion, right? Like if anyone's not being totally forthright, or they have some exposures that they might not even consider exposures, you're kind of all owning that together.
Right.
But in theory, that is definitely one way to do it, potentially, if everyone's really kind of being as careful as they can be.
Yeah. Perfect. I mean, it looks like that's most of the questions that we got. I do want to touch on kind of what the future holds here real quick. We don't have a firm date for the next one, but what I do want to ask is we are going to send out probably in the next couple of days a survey for what all of you in the audience would like to see for future topics. We already have a couple ideas kicking around, but we certainly want to use your input and your interest to kind of cater to what the topics are going to be in the future. And also, feel free to send us questions when we send these out in advance. That way we can prepare for some of the questions ahead of time. And, we appreciate the live questions too, obviously. But the more questions we get in advance, the more we can kind of make the talk go in the way that we want it to go for the audience. But yeah, so that'll go out shortly. I don't have a date for the next one yet. Probably either next week or the week after. It's not going to be too far in the future. But I want to thank you again, Dr. Cullinane. This has been great. Any other comments before we go?
No, just kind of back to those caveats before, that obviously we're touching on things very high level. So if some of this is like, hey, we're dealing with some of those issues and you kind of touched upon them, but not really, those suggestions maybe don't really apply to me for whatever reason, feel free to reach out to us. Like we all want to help get us through all of this in whatever way it is. So all the providers would be happy to do a visit and kind of help figure out what would work best for you and your family.
Perfect. Yeah. So give us a call, I guess, if you have any further questions. We can certainly help you out for your individual needs. And I guess that's it. So thank you so much for tuning in. Obviously, this kind of lives on Facebook, I guess, forever, not to scare you. So if anyone wants to rewatch this or replay it later, share it, like it, whatever else you want to do on social media, that would be great. And until next time, we'll see you then, okay? Bye.
Thanks, everyone. Thanks, Joe. Bye.